Okay. Okay, is that up?
You're good.
All right, well, again, I'm Kristen. I used to work in business development for Kaiser Permanente, so I did a lot of presentations just around general insurance and what it looks like. So TK, I'm going to apologize in advance because this is really kind of more aimed at helping people understand what's available from their personal perspective, but would definitely love to connect offline or later on if you want to talk more about some of the other pieces. I have recently switched into a role as a community engagement lead, and in this space, it's really more working in the community. Where do we put our philanthropy dollars to impact the social drivers of health? So coming back to this, I was updating my presentation again. I'm pretty excited to go through it. Feel free to, throw questions into chat or just unmute. I'm guessing Madison can watch that and let us know as things are coming through. But let me. Okay. So I wanted to start with a little overview of the Affordable Care Act, which is known out in public a lot of times as Obamacare. And only because there's a lot of confusion that comes in around it, what it was, what it created. And it was signed into law back in 2010. And the original intent of this law was really just to bring equity to health insurance, especially within the individual market. So what it did is it established minimum coverage requirements. It prohibited premium ratings based on sex or health. So there was a time when plans for women cost significantly more than plans for men because they were susceptible to things like maternity care and several other different things. So they would have to pay more for individual plans. It also provides premium subsidies that are based on income to help people cover the costs of that care. In addition, it creates some preventative care options that are covered no cost for the people who have these plans. And then it makes sure that all plans are presented in a similar fashion so that if you are looking and trying to compare plans with different carriers, you can understand what you're seeing and all of them look the same. Okay, I will say it does right now, you can still get rates that are based on, they take into account your age, your location, tobacco use, and then the type of plan you have. So whether it is just for you or whether it covers a family. And we're going to talk a little bit about the minimum coverage requirements later. And then also the difference between the individual market and the group market. So individual market is the place where people will go if you do not receive coverage through either your employer or a government-sponsored plan. Individuals are responsible for the full cost of their premiums, but they do have access to those subsidies. And a lot of other groups, it's not just individuals that fall into this. You have a lot of sole proprietors and a lot of independent contractors who have to get their own insurance because it is not offered through their company. Also, not all companies are required to offer insurance. So really small companies might not have access to that or be able to afford it. And so those employees also need to find ways to access insurance. And so the individual market is the place where they will end up going instead of through the employer. Okay, and then there have been a few changes to the Affordable Care Act. If anybody watched the debate, I'm sure you heard all about them last night. Some of the changes to it. And so there used to be an individual mandate on the Affordable Care Act, and that was put in place to try to help lower rates. So essentially, the more people in the pool, the lower the rates are overall. In addition, the healthier the pool, the lower the rate becomes for everybody. The individual mandate came with a penalty if you did not have insurance in place. It is dropped now. Not that it was completely repealed, but the penalty, there is no penalty. It's been dropped to zero. And what that did, though, was allow healthy people to drop out of the market if they didn't think they could afford it or they could do some of these other things. And it resulted in about a 32% increase for individual plans in that marketplace, especially within the middle section. So they have these bronze, silver, and gold plans. And so that increase was pretty high. For subsidies, in that marketplace, the average price of a plan is about $595 a month, which is still really high. For most people, they get some sort of a subsidy, and it usually comes out to about $145 a month for them after they get their subsidy. Those based on income, but they phase out at about $49,960. So if you make over that, you will not get any subsidy on the individual marketplace as a single person. For families, family of 4, that income limit is $103,000. So then it varies depending on where you're at underneath those numbers. But if you make over those amounts, you do not get any help towards that premium. Okay, the other big piece that it came in and did is it removes the ability of insurance plans to cut out people with pre-existing conditions. So there was also a time that if you had diabetes or cancer and you had lost your job or needed to change insurance, the insurance could exempt those coverage for those things for a certain amount of time. And then all of those costs were on yourself, even though you had insurance. So it did drop that. And originally in the ACA, it took away short-term plans. And so short-term plans were limited to 3 months only, and short-term plans didn't have to meet minimum coverage requirements. So it was kind of like a space holder. If you lost your job and needed to get something so that you had coverage in between jobs, or you were losing coverage due to divorce or something like that, you could get one of these short-term plans until you found something new. Changes now have allowed these short-term plans can actually go up to a year now instead of 3 months, and they can be renewed for up to 3 years. Short-term plans do not have to meet minimum coverage requirements, and they don't have to necessarily cover pre-existing conditions. So if you have been looking for insurance that falls within that short-term plan category, you really need to read your coverage and make sure that you understand what is covered and when you are covered. Some states, though, do create rules around these things. Colorado is actually very strict in this market space, and they still restrict the use of short-term plans. So any short-term plan in Colorado does have to meet minimum standards still. Okay, move on to some of these things. All right. Some of these things should look very familiar, and we're just going to come over the basics of them. These are the things you're going to hear when you're looking at your plan. So what is the premium? And that is essentially the amount that gets paid to the insurer to access their network of medical providers at their negotiated rates. So I always say, just think about it as that REI membership. You have to pay it just to get in the store or to access some of their services or whatever it is. The deductible is the amount you have to pay for services before your insurer begins paying anything towards that tab. So as you keep buying those products, they add up and you eventually get rewards out of what you buy. Co-payments, those are the amount you pay per visit, service, or prescription before your insurance will kick in. Co-insurance is something that I'm seeing a lot more of. And a co-insurance means that after you hit your deductible, you might have co-insurance. And so after that deductible is hit, you might still cover 20% of that bill, and then your insurer comes in and covers the other 80%, or it could be 60-40. Those are usually different depending on if you are in network or out of network, and you definitely want to make sure that you know what is covered and what is not. But that co-insurance stays in place until you reach your out-of-pocket max. The out-of-pocket max gets ignored a lot of times in favor of understanding what your deductible is, but the out-of-pocket max is important because that is the maximum amount you could end up paying for your healthcare in any 1 year period. Okay, and then coverage, since plans are obligated to cover certain services, all other services are optional. So there's 10 major things that are obligated to be covered under the ACA. And some states actually put in place higher minimum standards. So Colorado, for instance, adds in some pieces of infertility treatment even are considered mandatory coverage here. Okay. As I wanted to go into out-of-pocket maxes. There is a max on what those can be that is set by the state, or not by the state, sorry, by the IRS. The biggest one that most people fall into are those that are covered by health savings accounts. And so if you are on a high deductible plan, the maximum out-of-pocket for a single person is $7,000, and the max for a family is $14,000. And those are going to be for 2020, I believe 2021 actually, when I looked them up. So that's going to be those numbers that you want to pay attention to. And then we're going to talk a little bit about health savings accounts down the road. I think they're a pretty big way that people can help cover the cost of their own care. All right. Coverage and plan types. You're also going to see different types of coverage depending on what your job offers. The two most common you're always going to see are pretty much always an employee-only option, and then there's usually a family option. Depending on your company, they might offer you some of these other options in between, where it's you and a spouse or just you and dependents. In most states, employers are required to cover at least 50% of the employee-only cost. In 2019, the average employer actually covered 82% of the premium, and then up to 70% for families, which can be pretty generous. And then you also have plan types. So you always see these things, PPO and HMO. They're very similar, but then they also have some massive differences within them. Both of them provide you access to a network of physicians and hospitals that come at negotiated rates. The difference is a preferred provider organization, or a PPO, tend to be a lot larger in terms of choice and network, and decision-making is less centralized. That means you can go see any doctor you want at any time. You can pick out your own specialist. Most of the time you can go see a specialist without a referral. Whereas in an HMO model or a health maintenance organization, those decisions are usually centered around a primary care physician. Not all HMOs require that you have a primary care physician, but many of them do, and then they rely on that primary care physician to give you referrals if you need additional specialty care. And those referrals also go out to other specialists within their networks. It doesn't mean you get to just go pick anybody that you want. So there's a lot of differences, and you want to make sure that you know which one of these things work for you. HMO models, your health maintenance organizations, tend to be much cheaper because they have that smaller network, they have more negotiated rates, and they can control how things are done through that PCP. Whereas the preferred provider organizations tend to be a little bit more expensive, but you have a lot more flexibility. And then the other big piece is with out-of-network care. So most PPOs have two tiers where you know what it's going to cost you in network, and you know what it's going to cost you out of network. Many HMOs have a much smaller out of network option, if at all. And so if you are out of network, they might cover nothing. So you want to make sure that you understand those. Okay, this is page 1 of how the ACA has set up your summary of benefits. And every single plan you look at should have, it's like a 4 to 5 page overview when you are looking at insurance plans. And so I highlighted some of the places that you're going to find the things you want to know. So up in that top corner, where you know what kind of coverage you are looking at it, whether it's a family plan, are you looking at an HMO or a PPO? You definitely want to know what your deductible is. So is it a individual deductible, family deductible? And there's actually 2 types of deductibles if you are on a family plan. There you can have something called a true deductible or an embedded deductible. In a true deductible, so you have that, say it's that $1,000 for the family. In a true deductible, whenever you get to $1,000 as a family unit, then your health insurance premiums kick in. In an embedded deductible, both the individual and the family one apply. And each person is considered their own entity. So if you have, say, a child with type 1 diabetes, their healthcare costs are likely much higher than the rest of the family. And in an embedded deductible plan, when that individual hits the individual deductible of $500, their care is going to start to be covered by insurance, whether or not the $1,000 for the entire family is met. And so that can make a big difference if you have just one person in your family that has high medical costs. Okay. Next one down there, the out-of-pocket limit for the plan. So that's hidden down here in the bottom. It's going to tell you what that maximum out-of-pocket cost is for your plan. You always want to make sure you know what that is, especially if you are choosing a high deductible plan or one of the low cost plans where you're putting money away. You should always be aware of what your potential total costs are. And then down at that very bottom place is the part about referrals to specialists. Definitely make sure that you are aware of what those look like. Okay. And then the next page, there's actually 3 pages of this in your overviews, and it's going to tell you where you figure out your co-pays and your co-insurance. And you're going to notice that definitely when you are out of network, you're going to pay a much bigger portion of that cost. And so paying attention to those is going to be very important as well. Okay. So these are the 10 areas that are mandatory coverage requirements for all ACA plans. Some businesses, depending on who you work for, if they had health insurance in place before the Affordable Care Act took place, they had the option to grandfather in their old plan. If they were to make any changes to that plan, though, they have to bring the plan up to standards of current day. However, you could be in a plan that has not been changed since that point, in which case your plan might not meet all of these standards. So you still need to pay attention to that, or just ask your employer if you are under a grandfathered plan or not. But these are considered essential health benefits and things that should be covered for you. And these are all very important. My favorite piece on some of these things, though, is that the ACA came in and really focused in on these preventative and wellness services, along with chronic disease management. But the preventative and wellness services have items that you should be doing, and they are free from your deductible. You're not going to have to pay for those things out of pocket. And the idea is we try to keep people healthier overall. And so these are some of the things that as an adult, you have access to free screenings for these things. However, as an insurer, I'm going to tell you, you need to be very careful when you are scheduling your appointments. So if you go in for an appointment and you want to go through your blood pressure screening, cholesterol screening, whatever it is, and you bring up another ailment during that visit, they could charge that as a separate type of visit and not a wellness visit. And so you want to make sure that when you are scheduling your preventative health things, they are on their own so that you do not get charged for other care. Okay. Women, you have some extra things on here that also get covered for free. All right, and then I did send this presentation as a PDF to Madison, so you'll have these links available to go check on all of these things for yourself. And then kids as well. So kids have their own extra free preventative wellness activities that they can do. So parents, keep these things in mind. Okay, this is probably the most complicated thing in all of this when you start thinking about how do you cover the cost of care. There used to be a time where the premium that you paid in was equal to the cost of your care. As the cost of healthcare in the US keeps going up, employers especially were coming in and trying to find ways to keep those premiums low. And what that meant is the premiums might stay lower, but the cost sharing went up in terms of what you pay in order to access care. And so that's when you started seeing things like high deductibles and co-insurance and co-pays, and just adding on more that the individual pays on behalf of their own care instead of all of it being covered through the premium. And so now we've got a couple different arrangements that people are trying to use to help people cover these costs. The most well-known is a health savings account. And health savings accounts are available to anybody. You don't have to have an employer in order to have a health savings account. The only thing is you do have to have a high deductible health plan. And so if you have a high deductible health plan, you are allowed to contribute into a health savings account. This money lets you put aside pre-tax dollars out of your paycheck into this account that can help you pay for qualified healthcare expenses. And you get a debit card and you can pay for some of these things. There is a website out there that can tell you what they consider to be qualified. Gym memberships do not count. However, some over-the-counter medicines do. And so you just need to be aware of what you can actually use those dollars for. The best thing about healthcare savings or health savings account is you as an individual own this account. This money stays with you. It can be invested later on, and it rolls over year after year. So anything in there stays in there. You can contribute to this and your employer can contribute to this. However, there are maximums that you can put in each year. These are a great option if you are young and healthy. Definitely use this time while you are young and healthy to put money into this account that can roll over so that down the road, if something does happen, you have enough in that account to cover these things like your out-of-pocket maxes. If you want to start a family down the road and you have extra money in there as well. So it's a great savings tool. You're also going to see this thing called a health reimbursement arrangement. So that's an HRA. These are plans that can be set up by your employer. They are also owned by your employer. So your employer funds it, and your employer is the only one that can contribute to it. The money isn't part of your wages though, so it's not taxed in any way. It's just there for you to use. Some employers will let you roll that money over year after year, but some don't. They don't have to, because technically this is in their account for them to use to help you with your health care. And then the third one that you've started to see a lot of are what they call flexible spending accounts. And in this case, it's another one where the employer owns this account. Both you and the employer can contribute to this account, and these are, again, pre-tax dollars. The reason they call it flexible is because there's a variety of things that you can contribute to, not necessarily just your medical care. And so this can also be used, depending on the type, for dependent care, so your child care. And so if you have set expenses in that area, it might be a great idea to contribute pre-tax dollars to that and then reimburse yourself throughout the year. The difference with this policy is you do not get to keep the money at the end of the year, and the maximum amount that they could even let you roll over is, I believe, about $500. So use it, lose it type of deal. I think that's a little bit harder in the healthcare space when you don't really know what your expenses are going to be, but definitely for some of these other pieces where you do have set costs, it can be a useful arrangement. There's also a link up here to talk about all these different savings accounts, how you can use them to pay some of your different arrangements. Okay, and those are really complicated. So if there are any questions on that, definitely let me know. Okay. And then one of the next pieces that I always hear is, what do you actually need? And when we talk about healthcare and what your options are, there's a lot of things that you should consider. And the number one thing I ask people is, do you know what you even spent on your healthcare last year? And then most people tell me no. They might know what their premium is. They know what comes out of their paycheck, but they don't know how many office visits they had. They don't know what copays they paid for their medications, especially ones that you get every single year. Are you adding those up? Do you know what those look like? I know there's some insurance. Somebody in here was in the financial planning world. They might be doing this, so I'll give them a pass. But I would highly recommend that when you are budgeting at the end of the year, take some time and sit down and add up, what did I actually pay in premiums? What did I pay in copays? How often did I go to the doctor? And were those visits wellness visits, or were they something else? Because if they're wellness visits, remember, those are going to be free regardless of the plan that you are under. And so maybe you don't need as high coverage as you are getting. The other one to consider is your family on multiple plans. Would it be cheaper to put those plans together? Or if you are married with kids, is it cheaper to actually separate them out? If you go under an employee-only plan and then your spouse goes under a plan that is simply for person independence, can that lower your premiums, or what does the coverage look like? So I know I helped out, was talking with a couple who the wife worked for a rather large company and had very generous benefits. They had just recently gotten married. They had each had their own insurance before this. Her cost to add the spouse to the plan was going to go up about $150 a month. But the premium costs alone for the other spouse were about $185 a month. They could consolidate together, go under one plan, and what he was paying for his own insurance could easily go towards the premiums on his new wife's plan. And they can save money in that realm and all be covered under the same one. And so thinking about all of those different things is important. The other big piece is really down here on future planning. So are you looking at starting a family in the future? If you are, does that high deductible plan still work for you? Or do you think you need to go into something with richer benefits? Will you be adding or losing dependents from your plan? And I know we are all young professionals in this realm right here, so you probably don't necessarily have college-age kids that might be falling off your plans, but maybe it's the other way around. Are you currently covered under a parent's plan and you're going to have to move into your own plan? All of those things can change. And then the other big piece that I'm noticing now, especially in this new setting, do you travel often, or are you going to be working remotely? So I'm talking to people who are thinking about spending a couple months working remotely from a different place because they can do that. It works with their job now. If you do that, what does your coverage look like? Do you have out-of-network care? Would you be covered if something were to happen somewhere else? And so thinking about all these things might change the type of plan that you have. Okay. All right. Okay, that's where I'm going into questions because that was a ton of information and I feel really bad throwing all of it down your throats. But if there are any questions about anything, would love to get some feedback. Or would also love to know if anybody does actually know what their healthcare costs were for last year, because then I can change that answer when I do these in the future.
I definitely don't know, and I don't have an answer for you on that second one, but I do have a question. So how does the future planning about the working remotely in the future, how does that factor in on choosing?
So really when you're looking at plan types, so that PPO model versus that HMO model, if you're going to be spending significant amount of time outside of your in-network area, you need to understand what is covered outside of that. A lot of times, if especially on health maintenance organizations, so those HMOs, the only thing that's going to be covered if you are out of network are emergency services. And they're talking actual emergency services. So that means you would have to go into an emergency room to get care, which is going to be pretty expensive. You wouldn't be able to walk into an urgent care that is out of network because that's not considered an emergency. So sorting out some of those things and knowing what's going to be available to you versus the preferred provider organizations that might have a set list of what is covered and what isn't, even out of network. You might have a higher cost share of that, but at least something is covered versus nothing.
Okay, that makes sense. We have a question in the chat as well from Erica Holly. Can you have an FSA and an HSA at the same time?
You can. Yes. So whether or not you have the funds to fund both of those, although you could just slowly deteriorate what your, take that income and really lower your taxable income by putting money into both of those. However, the FSA is something that is employer sponsored, right? So if your employer offers it, that's when you can utilize those options. So you can have an HSA on your own. And then let me go back to that. And then if your employer offers an FSA, you can use those as well.
Erica also says she uses her HSAs for massages. What other non-traditional things can it be used for?
So I might pull up, these change because these are regulated much higher up than we are. So it comes through as to what they decide qualified medical expenses are. And I've even seen areas where, massages can be on the fence, but if you can link them back to healthcare, you usually can, put those things in there. It just depends. But think of also anything that would be considered complementary care. So if you go see a chiropractor, an acupuncturist, all of those types of things will be in there. Many of your over-the-counter medicines, so even just, your Advil, whatever you need in that thing when you're going into a drugstore, those things can be covered as well. So even if you didn't see a doctor and you're just kind of self-caring on some of those pieces. But I will send that link over.
Yeah, and like Kristen said earlier, she has a recap of all of this with the hyperlinks and everything included. And you'll be receiving that after this Zoom call via email, as well as a survey on Young Professionals meetings. So check your email after this and you'll be having both of those in your inbox. Kristen, there's another question in the chat. Do contact lenses qualify for HSA?
That's another one. I believe they do actually. Yes. So contact lenses and solutions. I've got the link up now, so that's a little bit easier. Also your feminine hygiene products, ladies. Can count towards those. General laboratory fees. If you were in an accident and you need crutches or a boot or other things, those things can be covered. I don't know how to find the chat now that I'm out of this. I think if I stop screen sharing, let's try that.
Does anyone else have any other questions for Kristen?
This is just a really quick one.
All righty. Not seeing any other questions.
Oh, I have one.
Oh, yes.
So with that account, so I was told you could also do like counseling through that account. Is that correct? Is it just certain types?
It might be certain types. So if you have a letter of like medical necessity, and it depends what type of counseling that you're talking about. So things like weight loss programs and pieces like that, those could be covered if they show medical necessity. General mental health counseling should be covered as something under your plan already. So that would have its own coverage requirements. There is a list of things that do not qualify. And so you're looking aromatherapy, spa salts, shampoos, conditioners, cosmetics, humidifier. This is actually a pretty good list, so feel free to check those out.
I have a question that's not related to the health savings account, and I don't know if you'd be able to answer this. I got married last June, and we added my husband to, I get full coverage insurance through my employer, and so I added him as my dependent or my spouse, only he's not American, he's from London. So we just automatically added him to mine, but it's costing me $420 a month to have him on my insurance. And we didn't think we had other options because he's not American. We applied for a green card and it's extra slow right now. So we're looking at almost a 2-year wait. He's not allowed to work and he needs to be insured. It's confusing because he comes from a country of free healthcare and he doesn't understand it and I can't explain it to him very well. But would there be other options for us to look, or do I just have to keep him with my employer at $420 a month?
That price is terrible and kind of extra. A lot of businesses now trying to keep costs low. When you do add other people to the plan, it is much higher. I am not entirely sure because I'll have to reach out to one of our individual reps to see if he qualifies for anything on the marketplace because he does at least have that card. But you would want to look and see, honestly, an individual plan on that marketplace, if you are over the income limits, is likely to be higher in that space. So it would be worth going on there and checking it out if he were to get his own individual plan.
Can he even get an individual plan if he's not American?
That's what I'm not entirely sure because he's kind of in the in-between space, right? So even though he's not fully American, the fact that you are married and he does have that card might put him into a category that I'm not entirely sure. There's a whole bunch of exceptions on this. Let me put my email in here and then I can send you contact information for one of our individual reps.
Okay. Thank you.
Yeah. Yeah, the individual marketplace is a little bit rough right now.
Awesome. Any other questions? If not, we'll go into announcements, but thank you so much, Kristen. That was awesome. And yeah, like I said in the chat, we will be sending this out in an email around 10:30 with the HSA list as well as the presentation she just gave. So thank you, Kristen.